So what is gout? Gout is a form of crystal-induced inflammation that is more than 3 times more common to occur in men than women. It develops in people with high uric acid in blood. There are 4 stages of gout. The first one is asymptomatic hyperuricemia, and is the period prior to the first gout attack. There are no symptoms, but the blood uric acid levels are high and crystals are forming in the joint. The second stage, acute gout or gout attack, happens when something, such as a night of drinking, causes uric acid levels to rise. This may be a triggering factor. The third stage is interval gout, and it's the time between attacks. Although there's no pain, the gout isn't gone. Low-level inflammation may be damaging joints. The third stage is chronic gout, and it develops in people with gout whose uric acid levels remain high over a number of years, and the attacks become more frequent and the pain may not go away as they used to.
Meat can have a very big impact on someone who is dealing with gout attacks. All meats are high in purines, but so are a lot of plant-based foods as well. Now, what exactly are purines? Purines are substances that are naturally found in the body and in foods. They are molecules that help make up vitally important compounds that are present in all animal cells and plant cells, including DNA, genes, RNA, protein synthesis, and ATP as an energy source. In the body, purines are broken down to form uric acid. When there is an excess amount of uric acid in the bloodstream or a buildup that cannot be destroyed quick enough, it transforms into sharp needle-like crystals in the tissues of the body, including the joints, which of course causes severe pain. Food is only about 30% responsible for the uric acid content in our blood serum. But a diet high in purines does put an individual at a greater risk for uric acid buildup, therefore resulting in more frequent gout attacks. So to answer the question if someone with gout should eat meat, I'd suggest eating meat and vegetables in moderation will be best to avoid future gout attacks. Some examples of purines that you may have heard of are adenine, guanine, caffeine, and theobromine, for example, tea leaves, and cacao beans. There are also some foods that are high in purines, such as meats, seafood, beans, oatmeal, mushrooms.
The enzyme responsible for production of uric acid from purines is xanthine oxidase. This enzyme is the target of urate-lowering treatments such as allopurinol. Allopurinol helps prevent attacks of gout by reducing the amount of uric acid in the body. The accumulation of crystals is reduced, and in turn, the body's immune response is reduced. A person's gout will usually become less severe over time as they continue to take this medication. It may take some time for the medicine to start working, but it is important to keep taking it. Allopurinol, also called Xyloprim, is a medication that helps prevent attacks of gout. Allopurinol reduces the body's production of uric acid by inhibiting an enzyme called xanthine oxidase. This enzyme is involved in the chemical process that produces uric acid in the body.
Nucleotides are important regulatory compounds for many of the pathways of intermediary metabolism which inhibits or activates key enzymes. The purine endabases found in nucleotides can be synthesized de novo or through salvage pathways that reuse pre-formed bases. The atoms of the purine ring are mainly made of amino acids and CO2. The purine ring is constructed by a series of reactions that add the donated carbons and nitrogens to a preformed ribose 5-phosphate. The first step in the de novo synthesis for purines starts with PRPP, which is an activated pentose. The synthesis of PRPP from ATP and ribose 5-phosphate is catalyzed by PRPP synthetase, which can be activated by inorganic phosphate and inhibited by purine nucleotides. Next is the synthesis of 5-phosphoribosylaniline from PRPP and glutamine. The amide group of glutamine replaces the pyrophosphate group attached to PRPP. The enzyme catalyzing this reaction is inhibited by AMP and GMP. The next 9 steps in purine nucleotide biosynthesis leads to the synthesis of inosine monophosphate, or IMP, whose base is hypoxanthine. 4 steps in the pathway require ATP as an energy source.
Age. The older you get, the bigger is the chance for experiencing a gout attack. It is most common around age 45 and older. Gender. Both men and women can get gout, but overall is it more common in men. Gout risk also begins at an earlier age in men and lasts throughout their lives, primarily because beginning in adolescence, men have higher uric acid levels than women. Estrogen tends to protect women from gout during the childbearing years, but after menopause, a woman's gout risk increases. Medical conditions such as diabetes and obesity. A number of medical conditions can increase your gout risk. An obese person is more likely to develop gout as someone with a normal body weight. Diabetes and insulin resistance may also play a role in the development of gout, as can having a problem with kidney function. Alcohol. Drinking certain kinds of alcohol can also increase a bout of gout symptoms. The reason for that is that alcohol consumption increases uric acid levels. Certain medications. Some medications can make your chances of having an attack of gout symptoms more likely. Examples include certain diuretics and baby aspirin. In many cases, however, these prescriptions are crucial to overall health and they should not be stopped just because they increase gout risk.